Other complications of diabetes. Some skin conditions caused by diabetes. Vitiligo. Insulin-resistant skin problems. Acanthosis nigricans. Skin condition which causes thickening and darkening skin in some areas, the skin folds. Problems associated with reduced blood supply to the skin. Problems with skin linked to atherosclerosis. Diabetic dermopathy. Necrobiosis lipoidica diabeticorum. Eruptive xanthomatosis. Digital sclerosis. Rashes, blisters and bumps. Diabetic blisters. Bacterial and fungal infections. Bacterial infections. Many different kinds of bacterial infections which affect the skin of diabetics. Staphylococcus is most common. These bacteria can cause boils, which is the inflammation from hair follicles, styes on the eyelids, bacterial infections of nails. Requires treatment with antibiotics. Fungal infections. Yeast fungus known as Candida albicans responsible for most fungal infections with those who are diabetics. Can be found in many areas of the body. There is one potentially fatal infection with a fungus known as mucormycosis is seen in diabetics, which occurs in the nasal cavities but can spread to the brain and eyes. Dental. Oral dental care is an area of complications for those people who suffer with diabetes. Because of problems with blood glucose, diabetics have a great amount of problems with dental care. There are a number of areas in the mouth that cause the most problems. A good majority of problems occur because of dry mouth, which is caused by decreased saliva. These problems can be avoided by chewing sugarless gum, eating sugarless mints, or melting ice, chips in the mouth, or taking frequent drinks of water. Another huge complication for the diabetics in the area of gum disease, also known as gingivitis and periodontitis. Your dentist also needs a list of all the medications and dosages you are on. Your dentist needs to have this information to prescribe medications for you that are least likely to interfere with other medications you're already taking. With a major infection, your insulin dosage will need to be adjusted. Foot care. Primary foot care intervention for diabetes is an important part of the diabetic's overall health care. The diabetic will need to learn all they can about foot health care as they have the most difficulties with their feet. This is caused by two problems: nerve damage in the feet, narrowing of blood vessels in the legs. Tips for diabetic foot care. Use warm water. Use mild soaps. Pat the skin dry, don't rub. Dry the feet completely. After cleaning your feet, use lotion to prevent cracks. Do not put lotion between toes. Make sure the skin between the toes is completely dry, as fungi and bacteria love to grow in moist areas. Examine the feet each day. Check the bottoms and tops of the feet. Check for dry, cracked skin. Check for blisters, scratches, cuts, or other sores. Check for any redness, increased warmth, or tenderness. Check for calluses, ingrown toenails, and corns. Do not pop blisters or sores. Apply bandage and wear a different pair of shoes. Take care of the toenails. Always cut your toenails after bathing because they will be softer. Always cut toenails straight across, then smooth with the emery board. Do not cut into the corners of toes. Care when exercising. Walk and exercise using comfortable shoes. Do not exercise when there are open sores on the feet. Acupuncture and reflexology are proven to be helpful alternative treatments for neuropathy problems in the foot. Primary foot care intervention for diabetes is an important part of the diabetics' overall health care. Diabetes and kidney failure. Diabetes has been named as the cause for the majority of cases of failure of kidneys or severe kidney disease. But there are many things which can be done to stop the kidneys from developing into severe kidney disease. Among these are to stop smoking and keep under control your blood pressure. Very intense management of diabetes can also decrease the risk of developing kidney disease or problems by 50%. High blood pressure is considered the major factor in kidney problems developing in those persons with diabetes. The solution to prevent kidney disease in diabetics is not smoking, checking blood pressure regularly, getting protein urine test, preventing high levels of glucose in the blood. When symptoms of kidney disease begin, it is already in late stages. There will be no symptoms in the beginning of this disease. When symptoms appear, they consist of fatigue, insomnia, weakness, swelling, vomiting. Diabetes and heart diseases. What is the relationship between diabetes and heart disease? It is believed that people with diabetes are at a greater risk of developing heart disease. This is because too much sugar or glucose in the blood causes damage to the blood vessels, and this is what raises the threat of heart disease. Atherosclerosis in the coronary arteries can suffer, which is known as silent ischemia or silent heart attack. A majority of people who have diabetes may also have more conditions which increase their chances of having heart disease or a stroke. When blood vessels which are clogged and narrowed, you can have health problems which are serious. Pains in the chest called angina, heart attack, stroke, heart failure. Diabetic retinopathy. What is diabetic retinopathy and what causes it? It is a very serious complication of the retina in the eye which often occurs in those who have diabetes. It can happen with any diabetic whether they have type 1 or type 2 diabetes. It usually occurs in diabetics who do not maintain control of their blood glucose levels or who have had diabetes for many years. As this condition progresses, these are some of the symptoms that can develop. Empty or dark areas in vision field, fluctuating vision, color vision impaired, night vision is poor, vision loss. These symptoms usually affect both eyes. Further complications can lead to serious vision problems. Vitreous hemorrhage, retinal detachment, glaucoma, blindness, diabetes and obesity. Currently, there are over 150 million people in the world who are suffering with diabetes and over 300 million people estimated to be obese. This results in 1.7 billion people in the world today with an increased risk of other life-threatening disease such as heart attacks and strokes. Control your weight, and the best way to control weight is to exercise at least 3 to 4 times a week. Exercise is considered a natural cure for many problems and diseases of the body. Diabetic neuropathy. What is diabetic neuropathy? This is a very common complication for those people who suffer from diabetes. Diabetes neuropathy refers to the damage to the nerves which causes a person to be unable to feel any sensations such as the feeling of pain. Diabetes damage can attack certain nerves in the nervous system. They affect the nerves in a number of different ways, but all seem to be somehow related to blood sugar levels, which remain too high for too long a period of time. Although nerve damage related to diabetes may be painful, in most cases it is not severe pain. Diabetic autonomic neuropathy. Diabetic autonomic neuropathy affects most often the digestive tract, as well as the urinary system, blood vessels, and sex organs. To prevent this type of neuropathy, a diabetic should continuously keep the blood sugar levels well managed. Autonomic neuropathy is more likely to occur in diabetics who have been poorly managing their diabetes for several years. Some of the symptoms of autonomic neuropathy can be hard to manage, but others do respond well to treatment. Diabetic peripheral neuropathy. This is the form of neuropathy which is most common for diabetics. It seems to affect the nerve ending first and usually starts with the nerves that are longest. This means that legs and feet are where the beginning of this neuropathy usually start. Rarely other areas of the body such as the abdomen, arms, and back may be affected. Diabetic proximal neuropathy. Diabetic proximal neuropathy causes pain usually on only one side. This usually happens in the hips, thighs, or buttocks. It can even sometimes lead to leg weaknesses. Treatment for the weakness or the pain is normally needed and can include medications and also sessions of physical therapy. Urinary incontinence. Diabetes is often associated with early onset and increased severity of urinary incontinence. Women with diabetes usually have up to a 70% greater risk of developing this condition. This seems to be a progressive condition which involves many symptoms, including urinary urgency, frequent daytime and nighttime voiding, incontinence, spasm in the stomach. Diet for diabetics. The main considerations when planning a diet for an individual with diabetes are 1. Calorie requirements, 2. Amounts of fat, protein, and carbohydrates, 3. Types of carbohydrate and fibers as well as the method of preparation, 4. Allocation of carbohydrates throughout the day, 5. Type of diabetes and what complications if any. Those foods which can help bring down blood glucose or sugar levels include bitter gourd or karela, leafy vegetables, papaya, lentils, oranges, legumes with skin and strings intact, bran, sprouted moong. Foods to be avoided: yam, potatoes, arbi, grapes, mangoes, bananas, chiku, dry fruits, dried foodstuffs, nuts such as almonds, peanuts, cashews, alcoholic drinks, foods which can be freely eaten: cucumber, tomatoes, radish, green leafy vegetables, lime, clear soups, black coffee with no milk or sugar, buttermilk, pepper, pickles without oil, karela juice, jamun fruit. Foods that should be absolutely prohibited include sugar, glucose, honey and all sweets, ice cream, cakes, pastries, jam, jelly, squash, canned fruit juice, sugarcane juice, and chocolates. For those people with type 2 diabetes as well as gestational diabetes, exercise is extremely important in managing these diseases. General exercise guidelines and precautions. Start slowly and slowly increase. Choose an activity you like. Consider a water exercise program, others including walking, riding a bike, muscle stretching. Exercise 3 to 4 times each week for 20 to 40 minutes each time. Spend 5 to 10 minutes warming up and 5 minutes cooling down. Wear proper and good fitting shoes. Practice proper foot care. Do not ignore pain. Drink water before, during and after exercise to stop dehydration.